Today we will talk about the topic giant cell tumor, which is a very common bone tumor and it's a benign tumor. It's not a malignant tumor. So the problem with this tumor, even though it's a benign tumor, is its high reoccurrence rate after local excision. So normally if it's a benign tumor, we can locally excise that tumor and that will be the treatment of that tumor. But in this case, we cannot just locally excise the tumor because it will reoccur again and again. The etiology is the origin is unclear, but microscopically it consists of undifferentiated spindle cells and multinucleate giant cells, which were initially thought to be osteoclast. That is why the other name of this tumor is osteoclastoma. The age group which is common is in between 20 to 40 years of age after the epiphysis have been fused with the metaphysis. The common sites include the lower end of the femur, the upper end of the tibia, the lower end of the radius. So it's more common around the knee joint and at the wrist joint. Not the joint though, I'm just helping you to remember the bones which are involved in this tumor. So let us talk about the pathophysiology. The pathophysiology is the location. The most common location is the epiphysis. On radiology, if we will see, we can see the three E's. It is an expansile tumor. It is located in the epiphysis and it's an eccentric tumor. And it has a characteristic soap bubble appearance. It's a lytic tumor, so we can see the soap bubble appearance. This is the wrist joint at the lower end of the radius. Clinical feature. The symptoms are swelling, pain and pathological fracture. So every bone tumor has these common clinical features only, that the patient will complain of a swelling, some vague pain, and if found in a later stage, pathological fractures are very common in these. On examination, we will see that there is a bone swelling with smooth surface and tenderness on palpation. There is eggshell crackling which is typically absent, and deformity of the limb if pathological fractures occur. This eggshell crackling is very rare to be found in these tumors. Though if it is found, it is characteristic. Okay. Let us talk about the management. The management includes different modalities depending on which area, like which bone is involved. So we can do excision. Excision can be done if the tumor is located in a bone where if we will remove that bone also, it does not impair the function. For example, the fibula, the lower end of the ulna. The other modality is excision with reconstruction. This is required in tumors which are present in the critical functional sites, where if we are excising that tumor, it will impair the function of that particular joint. So the techniques to reconstruct the tumor, to reconstruct the excised area, includes turnoplasty, where we split and we will invert the tibia, arthrodesis with fibular grafting, arthroplasty using autograft, allograft or prosthesis. Then there is extended curettage with some supplementary methods, because curettage alone will lead to high reoccurrence rate. So we will have to do extended curettage, where we can do, along with curettage, we can include cryotherapy, we can include thermal cauterization, filling cavity with bone cement. Amputation may be required for aggressive tumors or recurrent cases, and radiotherapy for technically challenging areas like the spine. Thank you.